Yeah, so giant cell arteritis is also known as temporal arteritis. It's inflammation, damage of the medium and large arteries in the head and neck, classically involve the branch of the carotid artery, most commonly the ophthalmic, and primarily affect individuals above than 50, usually female patients. Which part of the vessel is usually affected?
It's it's the mostly the media with intimal hyperplasia.
Yeah, so usually the tunica media and the intima as well. What are the pathological changes on a microscope picture? You'll be given a microscope picture and you describe the pathological changes. But in giant cell arteritis, what are usually the pathological changes in the blood vessel?
You have granular matter inflammation with fibrinoid necrosis,
Anything else you
and
want to say?
also there are skip lesions in the length of the blood vessels.
Yeah, so there are actually multiple changes. It starts by intimal thickening. As you can see here, the intima is very thick, and there is some granulomatous or inflammation to the lamina degeneration as well. And also there is T cell invasion or infiltration with lots of macrophages present as well. It's focally distributed, like we said, some skip lesions. I wouldn't call it skip lesions, but it's focal distribution. Okay. What's the initial test you will do for a patient coming to you with visual changes and temporal pain or temporal tenderness?
Temporal artery biopsy.
That's not the initial test. That's the best test, but that's not the initial one.
Okay, ESR.
So you want to start by ESR or some inflammatory markers, and then you move into doing biopsy later on. But what is ESR?
It's sedimentation rate. So
And
it's
how is it
basically
done?
it's based on the principle of relay formation of red blood cells by clogging when there is inflammation. So it is the time that it measures for the relay to form when blood settles after centrifugation.
Okay, that's not a very good explanation, to be honest. So basically, you take some samples, you put it into vertical tubes for 1 hour, and then you measure the sedimentation, and then wait for another hour, and then you measure the sedimentation of the RPCs. So the key point to mention here, you put it in multiple tubes and you store it vertically, okay? And then you measure sedimentation in 1 or 2 hours. What's the best test to diagnose giant cell arteritis?
Temporal artery biopsy.
And how does blindness happen in these patients?
It might occur due to temporal intimal hyperplasia that occludes the blood vessels of the ophthalmic artery.
I didn't get the answer. Are you able to say it again?
It might be due to intimal hyperplasia of the ophthalmic artery caused occlusion flow,
Yeah,
maybe to MRCS fluids.
yeah. You want to be a little bit specific here, and you want to specifically mention something called anterior ischemic optic atrophy. Right, anterior ischemic optic atrophy or optic neuropathy, sorry. Um, yeah, and this is basically when the blood clots from the temporal artery migrate and go to the ophthalmic artery. What's your treatment here?
It's usually high dose steroid initially you might start with 40 to 60 milligrams of prednisolone, but in the presence of impending visual loss, you might give IV hydrocortisone, probably 100 milligrams start for at least 2 weeks. Then you taper down with improvement of clinical symptoms.
All right, well done. Thank you very much. I think there is a continuation to this scenario. We're going to talk about the probably total hip replacement in a patient who has been on steroids for a long time. We're going to take 5 minutes break and then we'll resume, okay?